In poor countries, the access to healthcare is not universal. In fact, the World Health Organization reports that 1 billion people have never seen a healthcare provider. This leaves many of the most vulnerable segments of the population, particularly mothers, newborn babies, and preschool children, exposed to potentially lethal infectious diseases and many other health problems. This is why health programs in poor countries need to extend preventive and curative services beyond the existing health facilities and make efforts to reach communities and individual households. A team of scientists from the Johns Hopkins University in Baltimore, United States, and partner organizations led by Professor Henry Perry recently reviewed evidence that such approaches indeed make a large difference to the most vulnerable populations. They published their findings in a series of papers in the Journal of Global Health. Their review differs from previous ones because they studied not only whether the programs are effective in reducing the burden of health problems, but they also explored strategies on how to deliver health care at the community level and how this affects equity of outcomes in the population. The authors screened more than 12,000 reports found in the National Library of Medicine's database called PubMed, as well as any documents found in so-called gray literature, which is available online but not published in a peer-reviewed journal. They identified 700 reports that described the implementation of community-based health interventions in poor countries, which were assessed based on clear indicators, such as changes in population coverage of proven health interventions, changes in nutritional status, or in rates of disease or death. These scientists concluded that the evidence regarding the effectiveness of community-based interventions to improve the health of mothers, neonates, and children younger than 5 years of age is growing rapidly. So they created an extensive database with all the evidence accumulated. They are hoping that their work will provide the rationale for building stronger community-based platforms for delivering evidence-based interventions in high-mortality, resource-constrained settings. Their comprehensive and systematic review of maternal interventions provides evidence of the effectiveness of community-based interventions in improving key indicators of maternal morbidity and mortality. Most projects combine community and facility-based approaches, emphasizing potential added benefits from such holistic approaches. The effective community-based maternal interventions include education about warning signs of pregnancy and the importance of a safe delivery, promotion and provision of safe delivery by a trained birth attendant or other healthcare provider, prevention, screening, and treatment for HIV and other infections, and family planning. Community-based interventions will be an important component of a comprehensive approach to accelerate improvements in maternal health and to end preventable maternal deaths by 2030. The neonatal period refers to the first 28 days of life. Deaths in this early period are a disproportionately large proportion of all deaths in preschool children, reaching up to half of all deaths observed in this period. Lack of access to safe delivery care, emergency obstetric care, and postnatal care continue to be challenges that we need to overcome to substantially reduce neonatal mortality. The neonatal and child health interventions that have been shown to be effective include promotion or provision of good nutrition and immunizations, promotion of healthy household behaviors, and appropriate utilization of health services, diagnosis and treatment of acute neonatal and child illness, and provision and promotion of safe water, sanitation, and hygiene. They concluded that community-based interventions and programs can improve neonatal health in high mortality, resource-constrained settings, with a special importance for education and support for mothers and for establishing linkages between the community and facilities to improve referrals for obstetrical emergencies and for care of sick neonates. The effect is the largest if the facilities offer timely and high-quality obstetrical newborn care. Although there has been an accelerated decline in global mortality of children below the age of 5 years since the year 2000, mortality rates remain high in much of the sub-Saharan Africa and in some South Asian countries. The findings provided strong evidence that the major causes of child mortality in resource-constrained settings can be addressed at the community level, largely by engaging communities and supporting community-level workers. This review shows that there is strong evidence of effectiveness for CBPHC implementation of an extensive range of interventions to improve child health, and that 4 major strategies for delivering these interventions are effective, as we will describe in a moment. A growing concern throughout the world is the degree to which investments in health programs improve the health of the most disadvantaged segments of the population. There is an expectation that community-based primary health care should improve utilization of health services and the health status of the most disadvantaged children in a population. The team's analysis of a subset of projects that analyzed equity across one or more dimensions, such as socioeconomic status or geographical location, indicated that the majority community-based programs that implemented child health interventions achieved equitable effects. Given that they often reach down to all households, such projects are inherently likely to be more equitable than projects that strengthen services only at facilities, where utilization diminishes greatly with geographic distance. The decentralization of services is important for reducing inequities in countries with a high burden of child mortality, and is a necessary strategy for reducing inequities in child health and for achieving universal coverage of essential services. The team summarized the common delivery strategies of programs that have demonstrated effectiveness in improving maternal, neonatal, and child mortality. 6 key strategies were used. All of them required working in partnership with communities and health systems. They were 1. Collaborative program design and evaluation involving the community. 2. Community collaboration for program implementation. 3. Education for community-level staff, volunteers, beneficiaries, and community members. 4. Health systems strengthening to support community-level programming. 5. Use of community health workers. And 6. Delivery of evidence-based interventions in the community. In addition, 4 specific strategies for intervention delivery were identified. 1. Recognition, referral, and when possible, treatment of obstetrical complications and serious childhood illness by families, mothers, and/or trained community health workers. 2. Routine systematic visitation of all homes. 3. Facilitator-led participatory women's groups. And 4. Health service provision at outreach sites by mobile health teams. The authors identified 4 projects that have all demonstrated reductions in infant mortality, 1 to 4 year mortality, or under 5 mortality for at least 10 years. They share a number of characteristics. Notably, they provide comprehensive maternal, child health and family planning services. They have strong community-based programs that utilize community health workers who maintain regular contact with all households. They've developed strong collaborations with the communities they serve. And they all have strong referral capabilities and provide first-level hospital care. These shared features provide guidance for how health systems around the world might improve their effectiveness in improving maternal, neonatal, and child health. Strengthening these features will contribute to achieving the goal of ending preventable child and maternal deaths by the year 2030. Finally, in a concluding article, recommendations are offered from an expert panel that was established in 2006 to guide the review, which commenced more than a decade ago. The expert panel recommended that community-based primary health care should be a priority for strengthening health systems, accelerating progress in achieving universal health coverage, and ending preventable child and maternal deaths. The panel also recommended that expenditures for such programs should be monitored against expenditures for primary health care facilities and hospitals, and that expenditures for community-based primary health care be expanded to reflect its importance for averting mortality. Governments, government health programs, and NGOs should develop health systems that respect and value communities as full partners and work collaboratively with them in building and strengthening these programs. Programs should engage communities for planning, implementation, that includes the full use of community health workers, and evaluation. Community-based programs need to reach every community and household in order to achieve universal coverage of key evidence-based interventions that can be implemented in the community outside of health facilities and ensure that those most in need are reached.